Well, you know what? If you are in need of urgent medical attention, you know what? You might find yourself in the ER, but not all emergency rooms are created equal. Some have very minimal resources, unless you're in the East Valley and you end up at the Phoenix ER and Medical Hospital. CEO and owner, one of the owners, I should say, Dr. Ronald Genova. He's joining us to introduce the concept of micro-hospital. I just love it already. What does that really mean?
Well, good morning. Thank you for having us. A micro-hospital is just about everything you would want in a big hospital, but in a small setting.
Okay.
In our day and age, everyone seems to think that bigger is always better, and we would disagree.
Okay.
We think in the healthcare setting sometimes smaller is better.
I agree, especially, you know, we all like a little personalized touch, a little one-on-one. This is the shot of the outside of it. It's brand new. You guys just opened recently, and it's all owned by doctors, which is kind of unusual.
That is correct. I think everyone is used to having big healthcare corporations, Wall Street, owned hedge funds owning our healthcare, and we're really trying to bring back the concept of the physician controlling the destiny of their patients and helping their patients and serving them in a very direct fashion.
Okay.
So we're cutting out the middleman, so to speak.
Okay, I like that. I like that. We're looking at you along with some of your partners there. When somebody walks in the front door, what is going to be different? What is somebody going to notice immediately that is unlike a typical ER or hospital?
Well, first of all, it's going to hopefully be just a little bit quieter. I think everyone who has had the misfortune of going to an emergency department understands that there are so many resources that are being utilized. We're a little bit calmer. We're a little bit newer. You're going to have a very personalized experience. It's concierge care.
I like that.
We wish to have patients feel like they're part of our family, and we want them to feel like, well, if this was my family member, how would I like to be treated?
Right.
And I think everyone experiences are sometimes are not the best when they enter the healthcare field.
And being a micro-hospital doesn't mean that you aren't without the resources, because you still offer up all of the testing and everything that would be needed in any other setting. That
is correct. We have both an inpatient and an outpatient side to our hospital. We have a full-service emergency department. It's staffed by board-certified emergency physicians. We've all been in the field. I think the least experienced of all of us is a minimum of 10 years in the field. I'm approaching my 30th year. So you've got quite a dedicated, experienced team. We also have just a first-line set of nurses and techs and therapists, everything that you would expect to find in a big hospital. You're receiving here, but just in a much smaller setting.
How many beds do you have?
We have a total of 7 plus minus 1 emergency department bed.
Okay.
And then we have 3 inpatient beds. And then we have some other scattered treatment areas where there's some additional beds as well. Some that are focused on radiology or ultrasound or laboratory. But we have all the testing that you could expect to find in a large hospital.
And you want people to come in and tour the facility and check it out for themselves?
I think the only thing that really that we really wish to bring is, until you see it, it's really hard to understand. And I think the feedback that we're getting is that most people who actually come into our hospital like, wow, this is just such a different thing than I would have expected.
Right.
So part of our introducing our hospital is introducing that concept that you can have great things in small packages.
I like that. And the fact that you are all physician-owned, meaning that you're providing a different level of service. You've been in the trenches, you understand how it works, but you're still going to get that one-on-one, that personal touch.
And that is correct. One of our main things that we're going to emphasize is a lot of times people, depending on their acuity, may find themselves waiting a long time in other facilities just because there are some really sick people out there that really need a care. We're going to be a little bit less than that, quite a bit less, as a matter of fact.
All right. Well, I'm going to tell everybody where you're located, right?
Well, thank you.
You're welcome, because what they want you to do is come on down, take a tour, familiarize yourself with Phoenix ER and Medical Hospital, and when you do that, you are going to receive a complimentary travel medical kit for you to take on the road as a little thank you for stopping by. Phoenix ER and Medical Hospital is located at 3050 South Dobson Ranch in Chandler. Here's a number, 480-284-58. Dobson Road, rather, I'm sorry, in Chandler, 480-284-5867. You can learn more on their website at phoenixerhospital.com.